Are you struggling with gas and bloating? Hey, everybody struggles with a little bit of gas and bloat from time to time. But what about if you deal with gas and bloating all the time and it seems persistent and just doesn't want to go away? Hey guys, I'm Dr. Arland Hill and welcome back out to Harvest Hills Ranch. And today we're going to take a deep dive into gas and bloating that is persistent. Now again, as I alluded to just as we were starting out here, I'm not talking about the occasional you go out, you have a meal that's not such a great choice. You develop a little bit of bloat after that. You don't feel so great the next day, but in a day or two, your gut normalizes. That's not what we're talking about. We're talking about gas and bloating that is persistent. It seems like every time you sit down to have a meal, you feel like your stomach is enlarging. You feel like within a fairly short period of time, 30 minutes, maybe even less, you're going to develop gas, and it's just every single time you're sitting down to eat, and it's just gotten to the point where for you it's a problem. And what are you going to do about that? You know, it's very easy to reach for things like Gas X, other Band-Aids, some type of maybe something to deal with some indigestion, these types of things. But the reality is that we still don't have an understanding of what we're dealing with. And until we have an understanding of what we're dealing with, the likelihood is that the problem is going to continue to persist over time. And so I thought what I'd do today is dive into this idea around what's actually going on when you're having persistent bloating. It's occurring shortly after a meal, shortly after eating. It doesn't seem to matter all that much as to what you do eat, but you may notice that some foods seem to make it worse than others, but in general, it doesn't seem to make that much difference. That's what we're going to talk about today. And what we need to understand on this is that when this is happening fairly high up in the gastrointestinal tract. So if we think about that as we move from our mouth down to our anus, we're essentially just going from a north to a south direction. We're going to encounter the mouth, the esophagus, the stomach, the small intestine, the large intestine, and the rectum. And so if you go in that order, we again have to be fairly high up in that process, which means that something is going to most likely be going on at the stomach and more likely in the small intestine if your symptoms are manifesting that quickly. And so we have to begin to ask, well, what would occur in the small intestine and what would create these types of symptoms? And this is a very common observation that I see with patients. It's something that is very common in all of society out there. And interestingly enough, when we dig into this conversation, much of the medical literature still acknowledges this as not being a very well recognized condition in healthcare as a whole. And so more specifically, what we're going to be talking about here is small intestinal bacterial overgrowth. Sometimes this is referred to as small bowel bacterial overgrowth. But the idea is that we're seeing an overgrowth of bacteria. And just as a side note, this can happen with fungus too, but it's far more discussed around bacteria than it is with fungus. But what we're seeing is that there's an overgrowth in the bacteria in the small intestine. Now, as we look at the ends, meaning the mouth and the anus, the mouth, large intestine, anus, if you will, those areas of our gastrointestinal tract, they should have a large number of bacteria. There should be a lot of colonies of bacteria in these environments. But as you go down into the esophagus, and especially as we get into the stomach and the small intestine, especially the upper small intestine, these are what are considered to be very harsh environments. There's acid in the stomach. There's going to be enzymes and bile secreted in the upper small intestine, and it makes the ability of bacteria to persist in that environment very low. Well, in many individuals, for a number of different reasons, which we'll discuss elsewhere in other videos, these bacteria begin to proliferate in an area where they shouldn't be proliferating at. And what ultimately starts to happen here is that the resources, maybe stated a bit differently, the food that's coming in through our diet ultimately begins to become a site of nourishment or a source of nourishment for these bacteria that are overgrowing in an area where they should not ultimately be. And so when that begins to happen, Now these bacteria that again shouldn't be there, at least not in the quantities that they become there. You're never going to have a sterile environment there, and that's not ultimately the goal. It's just that we want to keep the numbers below a given threshold. But when they go above that threshold, now as that food comes through, they're starting to use that food as a resource, and they literally begin to outcompete you for that food. And in addition to that, they're going to start to ferment that food, and as a byproduct of that, you develop the distension, the gas, the bloating that comes from that. And not uncommon for individuals to also see changes in their stool characteristics here as well, where they may start to see some diarrhea begin to manifest from that. But just as a bit of a blanket thought process on this, the dynamics of the way that the stool characteristics become abnormal, and the transit time, how fast things move through your GI tract, that becomes abnormal as well. And all these things begin to precipitate or exacerbate, maybe better stated, this scenario around this overgrowth of bacteria in the small intestine. Now, I wanted to bring that to your attention again because it is something that is extremely, extremely common out there. It's also, as I alluded to, it's one of those things that by and large is under-recognized, and rather than asking the question most of the time, well, what's actually causing this? Typically the default is, let's just try something here. Let's just try a Band-Aid type of an approach. Take your antacid, take your digestive support, and see if that makes a difference. And that's not really getting to the crux of what the problem is. So I want you to think, if you're developing these symptoms or have had these symptoms, especially for any length of time, or maybe you've even had these symptoms and they've gone away and they've relapsed, that's a big indication that this may be your problem too, because the relapse rate on this overgrowth in the small intestine is in the mid 40%. So 44, 45% is what we typically estimate in terms of a relapse rate. That's pretty high. And so we need to be able to ultimately deal with and understand what we're working against so that that relapse rate isn't what's ultimately staring us in the face. Now, one thing I will say with you, just as I start to wrap this up here, is that if you've had to go on a course of antibiotics or some type of other antibacterial strategy and those symptoms seem to have improved while you did that, but again they came back, that is another strong indication that this is indeed most likely what you are dealing with. And so you would want to follow up on this overgrowth of bacteria in your small intestine, or what is oftentimes just simply abbreviated as SIBO, or small intestinal bacterial overgrowth. So if you want to understand more about how to deal with this, make sure you take a look at some of the other videos where I differentiate what are some of the interventions that you can use to address SIBO, why some are more valid than others. Also, do you need to test for this? There's a lot of tests out there. Does it make sense to test for these things? And no one wants to go through the process of treating a condition and then ultimately have it turn around and manifest again. So we'll also in these other videos be talking about how to prevent that from occurring as well. Hey, if you like the information, make sure you share it with someone out there who you think and who you know could benefit from this information, and come back to the channel and learn more about how you can ultimately improve your health. If you want to find out more about what I do, go to drarlandhill.com. And if you want to find out about real uncompromising food and how to source that for your family and put that on your table, you can go to harvesthillsranch.com. Till next time, guys, we'll see you soon.